Hello, I'm Giovanna, International Clinical Manager from Vinci Medical. Today, the class is going to be about ProDeep. Let's start with the science and technology. Here you can see the absorption curve. The brown line is melanin, the red line hemoglobin, and the blue line is water. When we are talking about non-ablative laser and ablative laser, it's necessary to look at the blue line, the water. Ablative laser has more absorption from water and works with vaporization. Non-ablative laser has less absorption from water and works with coagulation. Think about one kind of treatment, for example, skin rejuvenation. Ablative laser, we're going to do less session, but with non-ablative laser, we're going to have less downtime. Ablation works with vaporization of the tissue, and coagulation works with inflammatory effect of the tissue. Here we can see the wavelengths that is possible to find in the market that works with non-ablative laser. But with EthereaMX, we're going to work with 1340, ProDeep, and 1540, Go Smooth. The difference between them we can see here at the absorption curve. ProDeep has less absorption from water, and it has absorption from melanin too. In this graph, we can compare the ablative effect and non-ablative effect. Non-ablative deeper in coagulation, ablative vaporization and more superficial. Okay. And in this graph, comparing 1340 with 1540 nanometers. 1340, less absorption from water, so it goes deeper. In this biopsy, we can see the coagulation of the tissue, okay, and how the microthermosomes could be large. Talking more about non-ablative lasers, as I already told you before, we don't have too much downtime, and it's possible to work with body treatment, for example, stretch marks with low risk of hypopigmentation comparing with ablative laser, okay? And with cons, I can see that the number of sessions comparing with ablative laser, it could be higher, as I already told you before, okay? And about our ProDeep features and technologies. ProDeep is an exclusive wavelength, 1340 nanometers, and it works with 3 spot size, 3 fractional and 1 collimated. It works with a square format, and it gets uniformity, and it's easy to do the treatment. Work with a square format, it's easier than to work with the round format, okay? Here are the characteristics of ProDeep. The wavelength, 1340, the spot size, 2 fractional with 100 microthermosomes, and other with 400 microthermosomes, and 1 collimated. 80 millimeters and 100 microthermosomes, it has less density and more energy. With a 10 millimeters and 400 microthermosomes, we're going to have less energy, but more density. Comparing these tips, when we're going to treat, for example, stretch marks or skin rejuvenation that we need to go deep, it's better to work with 100 microthermosomes, okay? And the other treatments, for example, melasma or alopecia, we can use 400 microthermosomes because we're going to have more density and low energy, so it's going to be superficial. And the 6 millimeters, the collimated, we have an indication to work with 100 microthermosomes to treat active acne. It's a new protocol, but the result is good. And we can see here the fluence and the pulse duration. Here the screen. In the screen you can see the fluence, the pulse duration, and the frequency. The frequency normally we suggest to use 1 Hertz or 1.5 Hertz, okay? And the spot size with automatic recognition. Here we have a biopsy comparing the same spot size. Here, Dr. Luisa Pitassi used 100 microthermosomes in both treatment, but she just changed the energy, the fluence. It's possible to see that when you're working with low energy, the microthermosome is small, and when we work with high energy, the microthermosome is going to be bigger and deeper. So it's very important to think about it when we're going to decide which energy we're going to use in our patients, okay? Care and maintenance. It's very important to clean the spot size after the use. It's necessary to use just alcohol, okay? And the handpiece has a warranty of 500,000 shots. We have videos showing how to clean all the equipment and the chips in our YouTube channel, but it's possible to see the same videos in our site, evidencealaseracademytv.com. Clinical and practice. We can do ProDeep for non-ablative fractional resurfacing to treat stretch marks, the red and the white ones, scars, recent scars for surgical, for example, and acne scars too. Normally for acne scars, prefer to use non-ablative lasers or ProDeep when it is dispensable, okay? We can use for melasma, but melasma is very important to know when to stop. Normally we suggest just 1 or 2 sessions and then stop. We can put together with a chroma, for example, start with ProDeep, 1 or 2 sessions and then goes to a chroma, okay? Or we can use with drug delivery for melasma. We have good results to do it too, okay? We have off-label treatment for alopecias and onychomycosis. Here we have an article published by Dr. Carlos Alberto Antonio from Brazil to treat nodular cyst acne resistant to isotretinoin with ProDeep. Good result. And here, the same doctor did another published for hidrosadenite. And here we have picture before, after 4 months, and 3 years for after the treatment as follow-up. You can see the result continues good. All these articles and other ones we have for you. If you want to read more, just ask us, okay? The interval, normally we do a month, 30 days apart. Numbers of sessions can change 3 to 7. And it's possible to see here during the treatment and the second picture right after the treatment, we have erythema and edema. And especially for stretch marks, that we recommended to use more energy, as this is the case. So the downtime is going to be bigger, but it's not too big, okay? 2 days, and for face, normally that we use low energy, we are going to have 1 day up to 3 days, okay? We can use a numbing cream, but it's very, very important to remove before the treatment. We normally recommended to use a cooling system. Normally we use our Siberian, but if you don't have the cooling system, okay, you can work with ProDeep, but you're going to reduce the energy and reduce the speed, okay? Here we can see a treatment. Dr. Valeria Campos is applying in a patient in a face, we can see that she start down to up, stop applying the laser, and start again, up to down. It's very important to pay attention when you're going to apply, not to stacking, okay? Let's see here. And don't do the way that is showing there, because we have a booking of heat very deep, okay? So we need to pay attention with stacking. Don't do it anymore, in any case, and pay attention with the way that you are doing during the treatment, okay? And that's it.